I guess we're going to get started here. There is getting some more handouts, so we'll have more handouts for everybody. We had a little technical difficulty with the printer, so she ran back to get that. I really thank everybody for showing up. I'm quite pleased, to be honest with you, with this many people coming, so I really appreciate that. How this whole thing started 6 months ago with conversations with the Grays Harbor Hospital. It took a while to get things rolling, but we've met 4 times and come up with a plan on how to get this done. And I will say that what we plan to do here, as long as the public's good with it, is the same thing that's happened at Westport. And so what it amounts to is the city will do a build out for a clinic, and they will staff it and bring in the equipment for that. We are in negotiations on the rent and how that's going to be split out. The hospital did tell us that they would commit to 3 years for this clinic, and I think that was a really good deal for us. Now, I think they'll be here forever because I can't imagine that clinic not being busy every day. So they were a little bit hesitant. I think they didn't know how well received this idea would be and how well it would be used by the public. But everybody we've talked to said they were in favor of this and that they wanted to see a clinic here and that they would use it. And it would also help the city fire department to have a walk-in clinic. And I guess I'll turn that over to Chief Ritter and Assistant Chief Mandella, and they will tell you some of the ideas that will be a savings for the public and for the fire department.
Right, Ed. Thanks, Mayor, and I appreciate all the footwork that's gone into this. It's been a long time coming. I've been here for 20 years, and I've seen a few of these come and go, but it's no secret our population has increased dramatically. I think one of the biggest questions before anybody moves here is, hey, this looks like a dream, but one of the first questions that comes up is there any medical care? And that's huge. Even with my own family, when they've asked about property out here, they ask about the medical care. And the lack of medical care puts a ginormous strain on your fire and EMS department. We're all cross-trained as firefighter EMTs or firefighter paramedics. And anytime we get a call that we would consider non-acute or a non-life threat, let's say I've had a cough for 6 months and I'm calling you at 2 in the morning because I need to go to the hospital, or I have a sprained ankle, or some stuff that just absolutely could be more reasonably handled by a walk-in clinic, because what this is doing is this is taking our units out of service, even for a minor call, for 2 hours. So when we go from Ocean Shores to Aberdeen, we get our patient through the doors of the ER, we give our report to the nurse and the physician, we get back in our rig, we get restocked, and then we're ready for the next call. And a lot of these calls really aren't life threats. Now, don't get me wrong. I'm not saying to you, the individual, it's not the most, worst time of the day. You cut your finger open, or, there's something going on like that. And to you, it is an emergency. And I'm not saying it's not to us, but having a resource available like this is detrimental to your fire and EMS service, because the majority of time during the day, we average 6 to 10 911 calls a day. We have a minimum of 5 people on staff a day. We have shifts of 7, but there's vacation times and things like that because this is a career for us. And that puts a huge strain on us protecting the people that are paying us to protect. We've had cases where we've been out on medical calls and we've had structure fires. When we have a working structure fire, the average age here is 65. And I don't mean to sound negative, but most people aren't running out of their house on a good day, let alone a house full of smoke and disoriented. So when we pull up and set the e-brake on the engine, we have 6 minutes to make a decision on whether we're going to go in and make a grab or not. And if that's viable or not. And it sure as heck isn't viable if we only have 2 people on a fire engine because we're out taking a sprained ankle to Aberdeen. And that's the reality that we're in right now. So having the ability for this walk-in clinic to become a reality, a real reality, is huge for public safety. It's huge for us. And you'll see in the slide presentation and the handouts how many times we're doubling up and tripling up and quadrupling up. How many times we end up having to go out to the county because we're the only paramedics between here and Pacific Beach. So really, I think I would be remiss to say if I think I could do a better job as your fire chief, and Mike Mandella, who's been completely instrumental in a lot of the work that we're doing, is educating you on the realities of your fire department and the capabilities that we have and where we are severely lacking. I don't want to scare anyone, but at the end of the day, we live on an island and nobody's coming. And by the time they get here, it's probably too late. When we had the plane crash at the airport, at the same time we had a CPR in progress on Duck Lake. How much resources did we have on that plane crash? Not enough. Not enough, let alone somebody's having a heart attack and coding right down the street. We were able to peel off some crew to respond to that, thank goodness. And that's the thing. We've done so well on putting a Band-Aid over our problems that maybe you guys don't realize there's a problem. We have a problem. Our population's growing. Our people come here, they move here from, let's say, Snohomish County, where they have 4 doctors 10 minutes away, but they move here with a shoebox of medications and no primary care. So who turns into their primary care? We do. Now, I'm not saying that when this becomes a reality, and I hope it does, that doesn't mean we need less people because we're not running the same amount of calls and things like that. That's not true. It's just going to let us focus on real, true life emergencies instead of a lot of this non-acute stuff that we're going to. Because there's really no choice for you guys. What other choice do you have, right? So it will absolutely help remedy the issues that we're having with the fire department and being able to respond like we want to. We want to serve the best that we can. We want to give great service. But in this business, you cannot do more with less. You can't. We have 4 medic units out of that firehouse. So every time you see the red ambulance, it's not 1 red ambulance. We have 4. And we are constantly running. I'm sure you guys can agree. You see us going back and forth on the highway all the time. So I can't tell you how important it is that we get some kind of help out here with primary care, with a walk-in clinic, with something. We don't do stitches. We don't do x-rays. We don't do lab work. We don't do casts. We don't prescribe. And these are all things that can be handled by a walk-in clinic. So that's how it would benefit us. That's how it would benefit you. I'm excited to see where this goes. I think that once this becomes a reality, I agree with Frank. I wouldn't be surprised if more providers come out this way. I will say, to kind of tack onto this, we all care about health care. It's important to me. I just moved my in-laws up from Arizona into my home, and we're helping taking care of them, and it's a big job. But we are all invested in this community. The fire department's invested in you. You're invested in this, and I can't think of any reason why there would be opposition to this. And I mean, I would like to hear, I'm sure, money or whatever will come up, but man, we got a diamond in the rough here, and I don't want to see this opportunity pass us by. Years ago, we had an opportunity to become a hospital district, and we blew it. And unfortunately, there was a lot of fear-mongering, and it just got ugly and a lot of misinformation. So the fact that we can have a town hall, we can be open and honest about our fire and EMS department and how much we're strained and short-staffed and how much this might help us become more available when time is at hand. Like I said, we can't do more with less, and every time we're out of town, that's less responders. So I think this is a great solution to a big problem that we have. So I appreciate it. My door is always open. Mandella's door is always open. If you have any more questions, and I'm sure down the road we'll do a town hall specific to the fire department here so you can get your questions answered. But for now, I want to stay on topic of the walk-in clinic, and I think it's a blessing for this community, and I think we should all support it and watch this happen for the health and welfare of everybody here. So I appreciate it. Thank you.
Right. Thank you. So we can go to questions. I'm sure there's some out there. And we got Allison to help us with the microphone. So thank you, Allison.
You mentioned Westport getting something similar, or what? Can you expand on that a little bit about what Westport got and how they got it?
Yeah, Westport has a clinic that's they're not yet going yet, but they're same situation. They bought a building that they're putting this clinic in, and then they've also got room in their building for their offices. They're a lot smaller than we are, but that's what they're doing, and the hospital is supporting that. And so they're going to have a clinic, and I believe it's 2 days a week, Lynn? Yeah, 2 days a week. We talked about 5 days a week with the CEO there, and so I thought that was a good time to start out. 5 days a week, and I'm sure they'll be busy enough for 7 days eventually.
I'd like to know where are you planning to build the clinic? Do you have any plans for that? I'd also like to say real quickly, I love our EMTs. They're fantastic.
Yes, they are. We're not going to build a building for that. We have a place to lease that's available, and we're working out a lease with them and the hospital to get that supplied. We will be doing the build out in that lease space.
Do we have a timeline as to when this might be actually up and running to go?
It's going to take at least a year, and some of that has to do with licensing and getting, well, one of the things that was brought up, and Lynn knows about that, getting the license for pharmaceuticals. That takes a little bit. But the city will get on this as quickly as we can and get a bid out and, bring it to the council and get this thing rolling as quickly as we can on our end. There's some things with them with staffing and equipment. And like I say, the licensing they mentioned takes a little while with the pharmaceuticals to be able to administer those at the clinic.
Okay. I just wanted to say I worked for Snohomish County for over 10 years in their walk-in clinics. I was a float nurse, and we saw every single day over 100 patients in Snohomish County. And I can't imagine not having enough staff and enough hours open for all the patients that our little town will need. And so I hope that we're not just putting a Band-Aid on this. I hope that we're building up so that we can all have an opportunity to be less taken to the hospital. If you've got enough staff and enough doctors and nurses, you can do a lot. And so I'm hoping that we're not just looking at a year or two, that we're looking at 20 years from now too. And do it right the first time.
That's what we're hoping for. It's really gonna depend on how well it's used, and I think it will be used a lot, and I don't expect it to go away. But I wanted some kind of commitment from the hospital before we spent the money on this build out. Okay, I think you don't have the mic right now, ma'am, so I didn't hear what you said.
Hi, I just wonder if you could discuss economics a little bit. I know the payer mix here is largely Medicare and maybe some Medicaid, which is not, in most walk-in clinics, not exactly break even. I used to work in urgent care. I'm a nurse practitioner, and our clinic closed because 40 patients a day with a good payer mix was not sufficient to keep it open. So I recognize that there's been a 3-year commitment, but I wonder what happens then if it's not sustaining itself. And are any alternative models considered, like nurse practitioner ride-alongs with ambulance crews, like is done in some places, which is a little
I don't know that I
cheaper.
can. Go ahead. Lynn, please.
Well, I was going to go back and
Hello.
Oh, yes, I'm
Please.
sorry. I'm Lynn Csernotta. I'm the hospital commissioner for the North Beach area and Pacific Beach. And I just want to say that I know Frank has been working hand in hand with Tom Jensen, the CEO of Harbor Regional Health. And he's doing a great job. For years, we've been coming out here trying to find solutions to get an urgent care clinic out here. And a lot of it is economics, as we were talking about, and having the providers, because that's part of the reason I think that some people have been disenchanted maybe with CMAR is you get a practitioner, you get to know them, and they rotate out. So what we have asked communities to do is, if you can find providers in your area, which I know you're working on, and you've already introduced some of them to Tom and Elizabeth, who is our physician staffer, that helps immensely, because the issues at the hospital are the same that we have out here, is we don't have enough staff. So as long as there's staff willing to work here and work for Harbor Regional Health, that makes it very viable. And the walking before we can run idea is exactly what you said about staffing. As long as we have the staff, if we can do 2 days a week, if we can do 3 days a week, and we have the staff to do it, then that's what they will ramp up to do. And I did understand that he agreed to 3 years instead of 2, correct? So that means they're in for, the Harbor Regional Health said they'll be in for 3 years. And they want to make this work as well. I mean, this is not only good for the community, but it's also good as it supports the hospital. Because if we don't use the hospital, it doesn't, prosper either. So this will help put people into the system there as well. And the reason that you need to go with Harbor Regional Health is you are in that public hospital district. We are in that public hospital district. And that's the only viable solution, really, unless you get an outside company. And I don't know if you've looked at those, but I can share with you that Pacific Beach has looked at that, and it's very expensive. They bring people in, they run it from the ground up, they staff it, they do everything, but it's really expensive to support. So I know that's probably not a good option here. I know Pacific Beach is trying to do somewhat of the same thing. They do have some land, a possible, build out for a clinic, but here again, they have to come to the table with providers. So that's what they're working to do as well. But you're ahead of the game. You have a building that you're ready to build out. And it's my understanding, and correct me if I'm wrong, is there's room to grow. And I know there's room to even put in a possible portable x-ray machine and grow into that. Is that what I remember? Yeah.
Yeah, that's what we have
Tom
planned.
has suggested that too. He said, don't build for what you need now. Make it so that you can expand and grow into it. So he's been very helpful.
Yes.
Shared people and designs and options that you've investigated. So good job. Oh, yes, the payer mix. Yes, it is a struggle. Huge struggle for the hospital. I believe it's 80% Medicare, Medicaid, and only, if we're lucky, 20% payer mix. 20% insurance, self-insurance. And the reason there's a huge difference between Harbor Regional Health and Summit Pacific. Summit Pacific is a critical access hospital. They get paid over over what's stipulated. They get extra money, where we, as just a hospital at Harbor Regional Health, do not get that bump. So they're able to add on wings, but, you know, and have more facilities and things like that and make it look pretty. But that's because they're, even if they have Medicare and Medicaid patients, they get paid more per patient because they're considered a critical access hospital. But they also don't bring the services we do to the table. It's encouraging. We now are able to do cardiac caths elective, not just emergent. A new MRI machine is going in. It'll be state-of-the-art. We already have state-of-the-art 3D mammograms. Prompt care is now open for more day, you know, as day visits, you know, call the same day. It's just exciting. They're working really hard to bring it, you know, services to all, but it would be great to see something out here. It would be great.
I'm sorry, our fire chief wanted to address another part of that question.
I'm sorry, ma'am. To the nurse practitioner, you had asked about a nurse practitioner possibly riding out with the fire department. There's models out there. I know Mason County has one right now where they have a physician's assistant riding out. I believe his position is an FTE out of the fire department. There's also community paramedicine models out there. These are all programs. A lot of these programs were funded initially by grant funding. That's all dried up. I believe it dried up in Mason County, and they found a way to fund it. They went out and they got the money to fund that. I also know that the Grace Harbor County Public Health is aware of our problems in our area, and they have recently developed a mobile medical unit that they will be putting out in the different areas, including ours. They're working out the kinks right now. But it's a concerted effort. But I think the meat and potatoes of our problems, this is a big solution here. And I think they are viable questions. And it's one of the biggest reasons why in the past, the clinics that we have had in the past have closed down was because of reimbursement and funding. And I think we need to take a hard look on what that looks like for our community. I know a lot of us in this community also have supplemental insurance that would help out with some of those costs. And we also need to address the fact that we are a tourist town. And this walk-in clinic will also serve the tourists that come to our town and use our resources. So I know there's a lot of questions that still need to be answered, but I think the foundation is set here. It's a strong foundation. It's a great partnership with Tom Jensen, and I've been in contact with public health for quite a while. So the models that you're referring to about having a nurse practitioner ride out with the fire department or a physician's assistant or a community paramedicine program, they're all great programs, but just like this, they'll require funding and money to do so. So, what's that?
I'll be very brief. How many people in the room have been to the ER up at Hoquiam? Aberdeen, sorry. All right. How many of you waited less than a half an hour to be seen? Okay. How long did it take you to get there? Just think about that. How long did it take you to wait there? How long did it take you to get back? I'm saying this to put context on this. You have to think about this as a system-wide issue. We have a 911 center. It's overloaded with calls that are not necessary. We have a 911 response that follows that 911 call that's becoming overloaded because of calls that are maybe not necessarily or can be dealt with because they're low acuity issues in a different way. The hospital ER is certainly overloaded. The system is overloaded. Okay, we live in a community where, and I'm a member of that community, I'm also a member of the group who's above the median age. And I was concerned when I moved here just 2.5 years ago. And this is, to me, a lifeline. But again, for context, try to think about this as a system and think about this as a holistic approach to solve a problem within a system that is not quite broken, but if nothing happens, it will soon be broken. And who's going to suffer first? Medicare and Medicaid people, all right? That's us, all right? So let's think through this carefully. And let's try to present some options that are going to work for the good of the order, all right? Because that's what this is all about.
I just wanted to add one thing too. You go to the walk-in clinic and they can't treat you and you've got an issue, emergency type problem going on, they will get a hold of the fire department and they will take you to ER. So you have that for a backup. Yes.
I'm on. Oh, I'm going to just get up a little. Yes, my name is Libby Geis, and I've lived here for 3.5 years. And I am the triage nurse for Providence Hospice for Mason, Lewis, and Thurston County. And I work remotely out here, and I do triage for all the hospice patients for those 3 counties. With that being said, first of all, when I first moved here, I went to the fire department and I asked if I could volunteer at the fire department for that reason, because I had the experience and I was turned down because there was not enough money for me to be part of the volunteer fire department. Even though I watch it on channel. Even though I watch it on our Channel 2 Coast Communications, that they need volunteers, they don't have money for nurses like me who would like to volunteer. Secondly, where I'm going with this, I think it's a very good idea. I think if we're going to look into the future, first of all, we're talking about like nurse practitioners going on a ride. We're talking about, all these different things. But I highly would suggest, because the fire department is taking a lot of calls, that if this new clinic does have a triage nurse, because they can triage those calls and even maybe make sure that the people that are actually calling in really even have to come into the walk-in clinic. And if we're going to have a walk-in clinic, we should have a walk-in clinic that, granted, I looked at the list, that maybe we need to think about having a little more than just the things that we're having here. You said like an x-ray machine, but maybe we should be able to do labs, that LabCorp can pick them up. I mean, just different entities. I would love to be part of that discussion as a nurse and help with the community, but I do feel that the community has lacked in having funds for such as the fire department, such as the police department, and the EMTs, that whole thing. So that also has to be looked at, because they are still going to be the meat and potatoes, even though you have the walk-in clinic here. That's all I have to say.
Well,
I'm happy. I'm happy.
Do you need a job?
After I retire in a year and a half. Yeah, sure I do.
All right. Well, thanks for your comments.
Okay.
Oh, got some people over here. Allison gets her workout on these town halls.
Hi, I'm Jessica. I guess I'm just wondering, when you guys say you want the support of the community, what exactly does that look like? I've been here almost 3 years, and I don't think it's any secret that we all want health care out here. So is it like monetary, like it needs to come from taxes? What does that exactly look like? Because I think from what I understand, I'm a business owner in town and I talk to people all day, and it's like you hear this need, but then there's also people don't want to pay the taxes to get the things that we need. So is this something, when you say you're depending on us to get this here, is that what you're talking about? That it's going to come out taxes? Like, what do you need from us to get this done, I guess?
I need you to use the walk-in clinic. There's not going to be any raised
we all need
taxes for
it.
this.
Yeah, it's done. I mean, it's going to happen. There's families
think it
moving
will.
out here with kids. There are older people. I mean,
All right. Scott's going to address some more on that.
Hi,
Okay.
I'll gladly talk about some of the financial issues and what we're looking at and how we're looking at doing this. And I'll kind of step back in time. So, 4 years ago, during the COVID-19 crisis, our policymakers at the federal level were tasked with a very important decision to make. And the decision is, do we let the economy shut down and go into a recession as businesses close, or do we pump a bunch of money into the economy and have inflationary pressure potentially? And they chose to do the latter, and it's hard to second guess based on what could have happened. But with that, they used a number of vehicles to do that, and one was American Rescue Plan Act funding, and municipalities received a share of that based on their population and other criteria. So the city of Ocean Shores has received American Rescue Plan Act funding. We have used it, 800,000 of that to date, to help the Oihut ditch and the flow of our waterways. We've used $400,000 of that for the dog park. But one of the key pillars and one of the key things that ARPA funding was designed for was addressing local public health needs. And if you look at the pillars of what ARPA stands for and what it was meant to be used for, the creation of healthcare infrastructure in local communities is one of those key things. So this is not about a tax increase. We won't be coming to you and asking for taxes. We have a build-out model that is out that would cover. There's two things. One, a build-out that's about $350,000. Don't take that exactly to the bank, but that's what we're looking at to build this out. And then there would be a monthly fee of rent that we would still in the process of negotiating. So that's the only money we're looking at. We have about, I believe, financer, $800,000 left in ARPA funds. Upwards to $900,000 in ARPA funds. So we would take that money, ideally, with community support, and that's what we mean by community buy-in. If the community wants to do this and council says yes, we would use that money that was given to us for this very purpose and use it without having to raise taxes to build our clinic.
Thanks, Scott.
Hi, Nani from Ocean Shores. I wanted, when I came here almost 6 years ago, number one is I was very happy to see C-Bar out here. And, but when I went in, I was a little disappointed because things weren't running the way they're supposed to be in a regular hospital. But I was going to ask the chief, you also had a CPR program. In other words, you were training people from the community to learn CPR so that we can help you by keeping the person alive until you get there and then critique whether they needed to be moved to the hospital or not. That's number one. Number two is I've talked to several doctors. Whenever I go to my doctor, which ends up being in Aberdeen, and I ran into one doctor that, I don't know if you guys were aware, he was the doctor that was here in Ocean Shores. He didn't have a building where he was working from, and he didn't have a hospital, but he kind of like established himself at his own home, and he would go house to house to take care of the people here in Ocean Shores. One thing that when I talked to the people out there, they said there's no housing. So somehow there has to be something set aside or someplace where we can have the people that are going to come in and take care of us have a place to live so they don't have to leave us. So those are the two things I wanted to bring to your attention. Oh, and also, would you accept people who can come in to help until, non-paying volunteers? And if you are, then maybe if you can set up a system for that.
I'll leave that last question maybe to Lynn about volunteers at the, yeah. I don't know if the hospital,
who was that?
what they do with volunteers.
Was the question directed to the fire chief or for hospital volunteers? The last question about volunteers.
Ms. Lynn?
Oh, there.
That's a question I think we'll have to ask Tom and Elizabeth. I don't know about volunteers and what the insurance. I don't know. I know they use volunteers at the hospital, but most of them are in registration. But that doesn't mean that it couldn't be doable. So we'll put that on the list to talk to Tom about. He's in a meeting in Chelan. They're in a rural hospital meeting that I couldn't attend, so they're up there. But we can get in touch with him and ask. Certainly can ask.
All right, thanks.
Why wouldn't you want to get paid if you were? I mean, if you're available to provide the services and we're looking for providers and people to help, just saying. I mean, volunteering is great, but I think at some point you have to look out for yourself as well. And, if it isn't viable, then consider offering your services as an employee of Harbor Regional Health.
All right, yes.
Giving a little history, Seamar's trailer before they built the building was owned by Dr. Holmes. And before that, Dr. Trong and Wong were there on F visas, which was the way of getting doctors to rural areas. That's how we got them. Now, we used to call, when CMAR came there, the joke was it was CMAR Veterinary Clinic. Because if you needed an x-ray, you had to go to either the vet or at the time then the chiropractor. Our chiropractor no longer has x-rays. We did try to have a hospital district here. It was voted down, sort of not being able to see the forest for the trees. The hospital district paid and owned that trailer and also paid for those 2 doctors. And since then, after Dr. Holmes, it's been the decline in service from the hospital. We still could have a hospital district. And I know no one likes to pay taxes, but some of the things you're talking about is the right or wrong PA and also or nurse practitioner, etc. And those extra services could be established with a vote for a hospital district, be it nominal at the beginning. But just to give you a little idea, we're worth $2.75 billion in valuation for the city of Ocean Shores. Hospital District 1, which everyone screams and yells about, Summit Pacific, is worth $1.99 billion. And they take in $975,000 a year for their hospital district at close to the same 40 cents per thousand that Hospital District 2 does. So there's things that you need to think about to the future, because this model of using the facility with the reimbursement rates they're going to have still makes it struggle. And at some point in time, we're going to have to decide for ourselves what you need. Now, as to equipment, when we were doing the hospital district for $250,000, you could buy an older model MRI. Without imaging, which hopefully we'll get the mobile one, you can tell if it's a sprain or a fracture. Otherwise, we're sprinting it. The other issue is, go look at Harbor Regional Health, walk-in clinic, Montesano, the East Campus, and soon Westport. They operate from 9 o'clock in the morning and take their last patient at 1, Monday through Friday. And they both have nurse practitioners only. So look and see what they say. They say no imaging. They send you to Harbor Regional Hospital's imaging. They have limitations on their ability to perform. The doctor or nurse practitioner here, without any diagnostic equipment, is going to be doing the same thing. Not being able to tell. You can't fix a car without looking under the hood. And that's the reality here. So sometime you're going to have to make a decision. Do we step up like adults and say we have to charge ourselves for the services that we need rendered? And that's the reality.
Up here in the front.
Hi, my name's Mike. Couple things I want to cover. One was that a lot of people always ask, why not just go to CMAR? Well, I was leading a group for 2 to 3 years with a lot of really involved people. And we had meetings with CMAR and we had meetings with Harbor Regional. And we really pushed the envelope to try to get additional help here. CMAR was a continual no. No, we're not going to be walk-in. No, we're not going to be walk-in. Yes, you got to be part of our group, otherwise you can't come in the door. That's after 3 years, that's all we heard out of CMAR. So take CMAR and push it aside. Now this is going to start off as a small walk-in, but we're hoping in 2 or 3 years it builds itself up. So there's a lot of things a small walk-in can take care of. That doesn't mean it doesn't need to have all this fancy imaging stuff and everything to start off with. It's just something to get our foot in the door, and then as the clinic grows, we can expand into these other services. So people that say that, well, you got to have this, and you got to have this, and you got to have this, it isn't true. Because we're just starting off, right? We're going to build our way into it and be something bigger someday. And I know there's grants out there for rural medical centers that we could qualify for, where we can get a lot of help in the future with this clinic. So that's what I got to say about that.
Okay.
I wasn't quite done. What else did I want to cover? Well, you got my idea.
Thanks, Mike. I'm PJ, and yeah, we spent a lot of time over a lot of years trying to get all of the help and all of the information that we needed. So about a year ago, I got to go around door to door and speak with people, citizens here, and every single citizen said they want health care here. So I have a spreadsheet here that's filled with names and addresses, but I can't share it because I gave them all my assurance that that was private information. But I thought it was really fascinating. I think the other thing that we have to keep in mind is times have changed. We are now post COVID pandemic, if you will, and that means we've had a lot of people move out here who are working from home, who may be under other company progressive type insurance plans and so forth. We're a different community than we were a few years ago. And I think that if we keep the negative Nelly concept in our heads, oh, it won't work because this, that, and the other thing, we also have to keep in mind we've got some wonderful people now on our council and our mayor who is driven and he cares about the citizens, because you citizens are all top of the org chart now. Go, Frank, and thank you all.
Allison, he's been waiting for a while. Sorry. Then Richard.
Well, good evening, folks. And Frank, thank you for putting this together here. This is wonderful. I think this thing has been really needed and is now finally being looked at. But this gentleman back here hit the point of what I was wanting to talk about. There's grant monies available. And the thing is to get a good, solid grant writer. You get a good, solid grant writer, you're going to get the grant monies you need. That can expedite things in a lot of different ways. That's all I want to say.
And I am happy to help that. So we are looking at 2 grants right now. These would be grants that would just help us with the build out. Neither of them would cover the full cost of it. But those are things that I am researching right now, and I will end up writing those grants. I won't administer them, but I'll write them. I have some, if you want to help, I'm be glad to take help. They won't cover all of it. There is longer term grants that would be allowed for rural infrastructure through like the Department of Agriculture that would pay for things if we were to build it out. But those are long term grants, and they're nothing we're going to get in the next 6 to 8 months. So what we're looking for is grant money that would immediately help us do this build out, and I'm kind of tasked with that. All righty, you come get me then.
All right, thanks.
So first, Mayor Elduen, I want to thank you and the hospital staff for all of the hard work that you have put in to facilitate this happening. I can just visualize how much effort that has taken. Lynn Csernotta answered part of my question, and it looks like you guys have already planned for room for expansion. But the real question that I have right now, and it's premature perhaps, but how many treatment rooms do you expect this facility to start off with? And I'm kind of a nuts and bolts guy. That's if we don't have enough treatment rooms. So that's my basic question.
Yeah, the drawing that we went over with the hospital, and that was Elizabeth. She is kind of the designer there for the hospital, and with Tom Jensen, we'll have 6 rooms. So that's what we're going to build the whole thing out, whether we need it or not.
Hey, my name's Jim Donahoe, and I just want to say this is not just one person's effort. It's a group effort, and when hearing all these comments here, there's some really great resources in this room. I hope that we're able to channel those resources into a group that meets periodically and provides you assistance in your goal. And just beyond everything else, thank you.
I'm going to work my way back and then down. Sorry.
this section.
Sorry. I just wanted to know about, since it's through the hospital type of thing, I assume that it would be accepting certain types of insurances for people to be able to pay. Is that correct?
That's a Lynn question.
It would accept whatever the hospital does. So they would assess each person as they came in, but I can't imagine that turn anybody away. Yeah.
And it'll be open for everybody,
Yes.
not just people who use the hospital system for their primary care. So anybody can walk in and use the facility.
And I know you were talking about the hospital, having another hospital. I think that's an idea, but we can't find practitioners. It's a national shortage. There's a lot of reasons for it, and I won't go into them now, but it's almost robbing Peter to pay Paul. And we can't get enough practitioners in town. And part of it is, where do they live? They come here, we entertain them, and we are telling them how beautiful Grace Harbor is. We moved here from California, we love it, and invested in the community. But people don't see everything that we have to offer. And there's not a lot of places to live. We were going to live in a hotel until we finally found a place to rent for a year. So it's tough. Finding a place to live is really hard that you can afford.
We do have some people that work at Summit that would love to work at this clinic. So instead of driving to Elma, so that's a little bit of an advantage we have for staffing.
So I have kind of a joint question for Scott and Lynn. Is there a difference between the funds available for Randy's plan of a hospital district versus the community's plan of the walk-in clinic? So, I mean, if there's grants available for one, there's got to be grants available for the other, and I'm assuming that a hospital district would have much larger funds available for it versus a small community walk-in clinic. Could you, Randy, would you have any information on that?
I got to bring in the microphone.
Okay. Starting again. CAH, which is the rural hospital funding for Medicare and Medicaid, the additional money was closed by the state, but it was open when we tried to do the hospital district for Ocean Shores and North Beach. The hospital itself dropped down to 99 beds in order to get a higher reimbursement through the state. And there was special legislation that was passed for both us and the hospital, like in Port Angeles, I think Olympic, up there. So I'm not sure why the hospital itself is having issues. Just to give also, by the way, while I'm here, CMAR is 8,600 square feet. The nurse practitioner that was here and went out of business because he didn't have enough reimbursement was Tom Miller. And he was a nurse practitioner clinic that was across the street from IGA, where North Beach Realty is. The building in Westport was owned by Shelley Dubert, who was the physician there and ran the Westport clinic until she just retired. That's who the Westport bought the property from. So there's probably a lot of build out, et cetera, that was already in that building because they already had the ongoing clinic with her husband. So, as I said, there's a lot of history, a lot of things have happened over the last 20 years here. And to answer your question, yes, more likely not as us alone, Ocean Shores at 50 cents per thousand would generate $1.33 million a year. If you hired 24/7, 3 shifts at a facility with either nurse practitioners, receptionists, phlebologists, x-ray tech, a nurse practitioner, a RN, a CNA, etc., it comes up to about $330,000 a year cost to the personnel. And you can look those numbers up, just ask what an average so-and-so in the state of Washington gets paid. No, it isn't, because I looked it up and I added them up, 3 shifts. You can look it up.
All right.
You have to.
We got some hands in the back. Can we get the mic to them?
Thank you. I appreciate the time for us to be able to talk about this, and I want to look forward. If you're wanting to look backwards, one of the things that took place is that we have a hospital district number 1 who is a taxing authority, and we are bound to pay that regardless if we start our own hospital district. So we will be paying twice. Number 2, the hospital district that was started for Ocean Shores did not fail by ballot. It failed by the location that they used for the boundaries. They used the school district's boundaries, and that was not correct, and it was tossed out. This opportunity is something that we have been asking for a very long time. And we've also listened to everybody up there talk about the fact that the professionals that we need are at a premium to find. So what we can do is say, okay, we don't want to repeat what we did in the past, but we want to make our future better, and we want to have a clinic or an urgent care that is open for the most amount of hours, and we want to support it. That's what I think we need to be looking at. And I thank you for the opportunity to even have this discussion, let alone the work that's gone through it. Because there's been a group of us have been working on this for years. So I want to thank you.
Gina, I will second what she just said. And I know that these discussions have been going on for years, and Frank has taken what he heard to heart and is putting boots on the ground to make this happen, along with the hospital. So I think it's a great partnership, and I really think it's on the right path. And you listened to everything we shared with you, and the legislature shared with you as well, and helped make this happen by finding a spot, getting staff, figuring out what you need to do. So that's been a huge help. Thank you.
I'm sorry, I'm just going to take the mic one more time, and I promise I won't do it again. I was also thinking about when I first moved here. You know, we're talking about everybody that's in the 55 above club, but we also have children in this district. And we have to make sure that we are also available for our children. And I do believe, as far as if we're going to do a walk-in clinic, what's a few medical offices that you could have a primary, and my understanding here in the state of Washington, you no longer have to have a physician to run a clinic. Nurse practitioners can run a clinic, and to have them be part of a source so that you have almost like a primary care with a small urgent care. I don't know about the hospital district piece of it, but here's my thing, and probably people won't want to hear this. I hear so many people that don't want to pay. They don't want to pay the extra few bucks. I'm just flabbergasted about that. We pay so much money to live here. We pay so much money at our grocery store. We pay so many extra dollars to live here. Why? To have more taxes, to have a good healthcare system here. I've watched, you know, things that have gone through the city council, and why it gets disapproved because nobody wants to pay any extra money. Well, it's now maybe time. You know, what's that old saying? Buy once, cry once, or something like that. An investment. There's nothing wrong with having a good investment. And if we're not going to do it, I guarantee you Seabrook's going to do it. They'll do it. They'll find a way. So I think it's very important with as many people that are in this community, and we have children in this community, we should be looking into the full future, not just kind of a half here, and then we still are giving our money up into harbors.
All right,
that's what I'm thought.
Okay, I'm going to address the Seabrook. I have been in conversation with them more than once, and they're looking at doing the same exact thing that we're doing. The same exact thing.
It is taking them just as long. And they don't have staff. I think you might be farther ahead with people who might be able to work at the facility versus Pacific Beach. Nobody is available to come there. So the same things they're asking of you, they are asking of Pacific Beach and Seabrook, and they're saying, well, if you want to do this, we can partner with you, but you need to have people who want to work here. Where are we going to get these people? We are staffing our Montesano, Hoquiam, Aberdeen clinics. We've got the hospital. So if you can find us practitioners and give us a building, we'll run it for you. We'll help you make it work. But they have to do the exact same things. So they're struggling, and they have been talking about this since 2017. And they're just finally getting their land together, getting a builder, but it's going to be a year away. They talked about modular units, which we shared with you, but it's not viable for you here. And they turned that down too, and now they have to go to brick and mortar, and that's going to take longer. But they still have to make sure they have the staff for the hospital to count on. So they're not getting anything sooner or getting any breaks that it's the same ask.
Yes, I just wanted to point out one thing about the ride-alongs that kept getting brought up and everything. And one thing you got to remember, which is one very important factor that Chief Ritter brought up, is transportation. Even if you have the ride-alongs, you still have our ambulances going out of town the same amount of time. So this is something that is really needed to alleviate us on two separate areas. So.
And can I just briefly chime in exactly what Jane said, because that's perfect segue. It's a perfect addition. Our ambulances cost, what, $550,000 every time we buy one? Every run we take with those ambulances gets them closer and closer to having to buy a new one. So that $350,000 investment in ARPA fund money that we have to spend anyway, because it's not money, it's not coming from the general fund. We use that to build a clinic that allows us to not have to buy new ambulances, ends up actually saving us money in the long run. So I just wanted to compliment your point.
Hi, I just want to address the provider, or I guess any medical staff, recruitment and retention. It sounds like you've got some people in the pipeline, which is great. But for everybody in this room, remember that it's not just about the money. So housing was mentioned. Also, quality of life in the job. I have left urgent care positions because overwhelmingly the people I was seeing pushed boundaries, wanted to be seen for a laundry list of things every single time. And that really makes the job more stressful and makes the provider faster to leave. So the more that you're just nice to them, and that's all the medical staff, not just the providers. The more you improve their quality of life, and from a municipal point of view, the more there can be non-monetary compensations. I've heard of models in rural areas where, a full month straight of time off was offered because you're trying to recruit the type of person who wants to go do a volunteer position somewhere, or things that they can't get elsewhere that are compensation, that are quality of life things, but not necessarily money. So, consider all of those things when recruiting.
First off, I need to speak for my brother. I'm his caretaker. He's 78. He has illnesses I can't pronounce. The worst of them would be Alzheimer's, diabetes, AFib. He's immobile, and he's also has partial VA benefits. He broke his neck in the Navy. He hates CMAR, and that's where he has to go now. It's 4, 6, 8 weeks to get an appointment. It's never with the same person. They've been through 2 doctors already. The new doctor that replaced the one that retired at Christmas time, he's gone already. And I personally, and not bagging on the hospital, but if I take him to the hospital, which I do a lot unless our outstanding fire department transports him, I'm surprised we're not on a frequent call list. Do you need a ride this week? You know, they're regulars at our house. And so when I take him to the hospital, I sit in the parking lot and I take a book and I sit there anywhere from 4 to 6 hours waiting for him to come out. Yeah, it's not fun. So he was excited about the prospect of being able to go to a clinic and have somebody look at him and say, "You're fine, just calm down, do whatever you're supposed to do." Or, "No, you got issues, we need to call the ambulance, and our local fire people will come and save him once again and drive him to the hospital." So that's for my brother. For me, I just like to say, I'm sick and tired of looking backwards. I would like to look forward. And I'm sick and tired of the naysayers in this town. You know, please, let's just stop that. Let's just move forward, please.
Hi, my name is Ritter. I've been here for 7 years now here in Ocean Shores, and I've got one question, and then I've got a comment. The question is that Frank, you mentioned something about 5 days a week. What 5 days are we looking at? Because we have a lot of people here on the weekends during the summertime, and we're going to need that open on the weekends, I believe. The other comment I have is that I've watched a lot of people that I know move out of here because there is no decent medical, care. And, as we all get older, that's my concern. That's my worry. I figure maybe I'm lucky if I have another 10 years living here. I love living here in Ocean Shores, and I'd like to stay here. But if it gets to a point where medical issues become, major issues in my life, my kids are going to force me to leave. And I'm going to hate to leave my house because I love it here.
Okay, your point about the 5 days, that hasn't been nailed down, but the 5 days was, as Lynn mentioned, had to do with staffing. So I don't think it really matters what 5 days that we have that clinic open. But that's part of the negotiations with Tom Jensen and myself.
Question, where it's going to be under the Harbor Regional Hospital umbrella. So they'll take uninsured, because that's what I'm worried about. You got a clinic, you're trying to, keep afloat. You have a lot of uninsured people. Plus, if you have people out of town, you don't have insurance. I could see that could be a problem. That's the only thing I worry about. It's like, so, and staffing's also a concern. And I don't want it to be, oh, you build it, they might come. I want to make sure you've got people on the pike, which is great. So we build this and we're on the hook for the lease. But I want to make sure we have, it's going to be staffed. So.
You're right. But what I have learned being part of the hospital is they do a lot with what they have. They have found a way to make it work and keep making it work and spend that dollar to the best of their ability. And it's going to be, all their other clinics are thriving and doing well. So I can't imagine with the population here and the people willing to support it that it wouldn't be viable. I think Tom is pretty optimistic, and he just, he said we just have to start slow, have the team here, and then it goes from there. And that's what they're hoping with Westport as well. And yes, it was an established clinic before, so they're going in for a few days a week again, getting it up and running, and they're going to take it from there and see what happens. But if they're committed to 3 years, I think in 3 years, that's a good start, good running start for all of you to support it. All of us, because this is going to be closer for me too. So, just
closer for everybody up to North Beach. So, yeah, they're going to do 2 days a week because of staffing. They also have, I believe, around 3,000 or maybe a little less than 3,000 people in Westport, and we're close to 8,000 here. So,
I first off would like to say thank you to Frank, to the fire chief, to all of you up there who've been working so hard on this, because I know we've tried a number of times to do a number of different things. We know that rumor mills are very good in larger communities like this. What I'd like to propose to you is that you set up a citizens group, a small citizens group that can work with you guys to literally, whether it's a printout of facts or whatever, that can get that out to the community, that could go to things like the Elks Club, the Lions Club, those kinds of things, other clubs, talk about these things, bring back questions that those people might have, so that we make this a really open-ended conversation, so that the residents feel like they are a part of it and they're not just being told. Because for a long time, the residents on a lot of things were just left in the dark, and then they were just told this was going to happen, or it just wasn't. Let's really bring the citizens in. Let's get that citizen involvement so that we can really make this a successful thing.
All right, thanks. Any other questions?
Hello, yes. My question is, you referred to a hospital a couple of times. I don't know if you named that hospital. I was curious what hospital we're talking about.
Harbor Region. Oh, I'm sorry.
And the location, you mentioned you have a location picked out. Are you able to share that with us?
Well, it's Harbor Regional Health, and then I'll turn it over to Frank. Even though I know where it is, I think this is his.
Yeah, we're in negotiations for the spot where Beach Bums was at. And the reason we looked at that is because there's plenty of parking there. The pharmacy's right across the parking lot. So we thought that was a good location.
So I have a question. Actually, they're really basic questions.
We got a question back there in the back. Go ahead.
Yeah, okay, yeah. What did we miss up there? Okay, never mind. Couldn't have been that. Well, what I want to know is the chief said that we get roughly 10 calls a day. I'm curious myself to know, of those 10 calls, roughly a day, what percentage of those are calls that would actually might go to a walk-in clinic, rather than say like a fall, they're not going to go to a walk-in clinic. They fell. They're analyzing themselves whether they have a broken ankle or not. That's not a walk-in clinic kind of customer, I don't think. So of the calls that you get, of those 10 calls, what percentage would be calls that could normally go to a walk-in clinic?
Captain Cool, how many calls did you respond to in the last 24 hours? How many of those calls that you responded to in the last 24 hours do you feel could have been handled by a walk-in clinic?
Not in this rotation, but I'd say maybe on average, maybe half of a call a day out of the 10 maybe be used to go there. But so it would maybe be a couple hundred calls a year.
The hard part is to put a number on this because we haven't had it yet. But what I was getting at when I first spoke was about the non-acute things, like somebody has a fever, somebody has a cough, somebody might need some lab work, someone might just need an exam. I mean, you guys are driving into town to get a physical, driving into Olympia to get basic basic things that could easily be handled by a walk-in clinic. I've had a lot of people ask me about numbers, how much, how many calls would it relieve you? I would say a good portion of calls that we go on, many calls that we go on, could absolutely be handled by a walk-in clinic. I can't put a number on it, but it definitely, the whole point of this is to keep our resources in town for those true life emergencies. Because you guys would be surprised how many times we do CPR. You really would. You would be surprised at how many times we go on overdoses and suicides and things like that, and structure fires and things like that. It's not all over the news or anything like that, but a lot of these true life threats, this walk-in clinic would make us more readily available. So it's hard to put a number on it until we get it established, and then we really can collect the data and come back with true numbers.
Okay, so along those lines, though, I come from a community where I could call 24/7 a nurse and ask them, is this dangerous enough, provided these symptoms, that I should consider, emergency or not? We don't have anything like that here, and I'm not aware of anything that's like that. So I'm wondering if there's something that we could do like that would help to deviate some of the people that would normally just go ahead and freely call 911.
I would say in a lot of those cases, when you are calling an online or somebody on the phone to cover their butts, do you know what they tell you? Call 911.
They do a lot of times, but I have had them say, well, it sounds like, okay, sounds like you're having a kidney stone.
Yeah.
So you should get in. At least I know what it is.
Yeah.
I'm not calling 911. I don't think I'm going to die.
Right.
I realize it's a kidney stone, and I've heard of those. And it didn't feel good, but I was going to get to the doctor. So I didn't call 911. That's my point. Okay, I have a question for Frank. So there's a difference between CMAR and a walk-in clinic. And I'd like to know what are your plans to be able to educate the community as a whole to the differences in when they should be going to a CMAR and when they should be going to a walk-in clinic?
Well, we're starting on the education tonight on that, but CMAR, you have to make an appointment, and it could take up to 3 months to see somebody. The walk-in clinic will be available for you to walk in and see somebody.
One other thing I wanted to add to it, the gentleman's question to us about how many calls it would alleviate, and Chief Ritter's point, is a lot of folks don't have an alternative, so they put off calling us until it's really bad, as opposed to going in to a walk-in clinic and getting it seen and getting it dealt with before it becomes an emergent situation. So that's a really hard number to quantify as well, because they do tend to wait because they don't want to do the whole transport rigmarole into the hospital and all that jazz. So that's, again, to Chief Ritter's point, that's going to be a hard number to guesstimate.
Hi, my name's Caroline, and I kind of want to follow up in this conversation. It's a very difficult number to quantify because you have people like my husband coming out of a store here in town, and his left foot trips on the concrete thing that's supposed to stop a car, and it stopped him, and he went to the ground. This was late November. We had nowhere to take him. He managed to get up. This was on a Saturday. 4 days later, I'm driving him to Summit. We didn't call 911. We didn't think he'd need it. He broke his wrist. If we had a walk-in clinic here in town, I wouldn't have hesitated. Rather than a 50-mile drive to the ER in Elma, I would have made a 2-minute drive to the walk-in clinic here in town. He would have had x-rays done. They would have known he broke his wrist and a chip on his shoulder. How many people have things like that happen to them where, oh, I think I'm okay, I'm just going to ignore it, or it's not bad enough to call 911. We got him up off the ground. We didn't need to call 911 to get him up off the ground. Where I'm grateful to our EMS, are the times that my husband is in what I call the basement. He's a diabetic. He's a severe brittle diabetic. He gets to where his low blood sugar is to the point where I can't do anything with him. And sometimes he's on the ground in my house. I call them, they come, they take the time necessary. They don't have to transport him, but they get him awake again and functioning. And I'm so grateful for that. That's two sides of the coin on one person alone. Times we've needed to call 911 and times we haven't. People come here to town, they're visiting, they get hurt. Maybe they wait till they get back home. If we had a walk-in clinic, we could help them right away. They wouldn't have to wonder, oh, did I break something? Am I going to be okay? Should I get it looked at? Any injury, any illness, you don't have to put it off when you've got the care right here in town that you can go to, and you don't have to make a 26 to 50 mile drive one way just to find out, go home, you're fine.
Okay, so having better medical care here, like a walk-in clinic, has been something that the people of Ocean Shores have wanted since the conception of Ocean Shores. And we always fall short on getting it. I had conversations with the previous two mayors and was always told, not once, not twice, not three times, but many times, it's never going to happen. We're not going to do that in here because the city doesn't want to be involved with it. So tonight, because of Frank, this has been like a breath of fresh air, and it's a really neat thing to partake in, see everybody here all on the same page. Thank you.
Thank you, Frank. My name is Biff, and I've lived down here for 35 years. We built our dream home down here. My businesses were all over the state, so our home base was in Kirkland. But we want to be down here for the love and the beauty of the area. Now, I've got to thank Frank for leading the group here. We can't drop it from here. Now we, sitting in this room, have to take over and help them. We just can't leave it like it's happened before. And like the young man said over there with the hat on and the white beard. I also talked to the old mayors, and they didn't want anything to do with it. Nothing to do with it. Look at Ocean Shores gives more money in their tax base down here than any other community in Grays Harbor. We are number one. This city is a destination city, and if you read the paper and read the articles, we're in the top 20 cities in the nation. You take our population of, 7,000 plus? We go out to 2.5 million in the summertime. My goodness, the 4th of July, there's probably 250,000 people that come down here. We need a clinic. Frank, you're our leader, and it's up to us, the people in this room, to support and help you. Just be our leader and tell us what to do. Because I'm retired and I'm tired of leading the group. You're appointed.
So I just wanted to speak to, there were a couple comments about, quantifying the number of calls that go in to the fire department. And as somebody, I have 2 small kids at home, and we have called the fire department before. We call the fire department to determine whether we need to go to the hospital. And you go to the hospital for something that's life or death. My son is probably in urgent care in Elma, or I'm on my chart with his doctor 6 times a month. So there are a lot of things that are kind of these interim issues where you can't wait to get into a regular doctor, but you don't need to go to the ER. So I don't necessarily know that questioning the fire department about the number of calls coming in is really valid, because if we had something like this available, they wouldn't be getting those calls, and people would be going to the doctor, like you said, ma'am, sooner, because the option is ER or wait several weeks to get in. And we need something in between. The older community needs that. Kids need that. Like, we all need that. So I just think that's important to remember, because you're dealing with emergencies. I don't think most people just call you because their foot's hurting. But maybe. Okay. So anyway, for what that's worth.
I just have a really quick observation based on what Captain Cole and Chief Ritter has been saying about the transportation back and forth to Aberdeen. The money saved in fuel going to Aberdeen can probably come close to paying the rent on this facility. Way to go.
Good point.
Just something really quick. Mayor Elduen, while I appreciate you have done so much and you are leading and moving forward, I also want to thank the whole city administration, because he needs the backing of good people behind him to get this going. So thank you to the city as a whole for charging forward and listening to the citizens and trying to get us what we need and what we want.
I want to also say thank you to the staff. Nobody does anything by themselves, and we got a great staff, and they're making things happen here in town.
From what I hear in this room is most people are for this. There's a few that aren't. A lot of people are worried about what has happened in the past, which I have no idea really. But what I got to say is that we all know we need this. And if it doesn't work out, hopefully it does, but if it didn't work out, it doesn't work out, we will not lose anything. Let's just go for it.
And I would just like to add to the list of people that need to be involved in making this happen is our city council needs to stand behind our mayor, please.
Yes. The whole council.
Right up front.
I want to second that. This ultimately, tell me if I'm right or wrong, this will have to be presented to the city council to get approval?
Yes.
Okay, so we need to let our city council know that this is what we want. We want this. They need, if they have objections to this, they need to put their objections aside and listen to the top of the org chart, which is the citizens of Ocean Shores.
Sounds a little aggressive. There's been some of us working on this for a long time. We appreciate the support, and we don't need aggressiveness from the public. What we need is your support. So there's no, I'm sorry.
I don't agree with you, Mr. Hartman. There hasn't been no aggressiveness here at all tonight.
To me, what you just did is aggressive. So what you asked earlier when we got here is, what can you do? What can the audience do? What can the citizens do to help us? So I am so proud that Frank and the staff has moved forward. I know that the most important part of this now for me as a council person is the contract and the agreement that they get from the CEO. None of us are going to be pleased if they deliver personnel that can't do the procedures and the things that you all are expecting. We do want them open more than a few days a week. We do want them to be able to do stitches. We do want them to be able to do other things. I've spoken to Rick, I've spoken to Biff, I've spoken to a lot of you about this stuff. And that's really important to me because this is a lot of effort. Number two, it's always about the money. There's not one person in this room that's ever come to me and said, we appreciate you spending more money. The fact that they've seen, You guys do a lot of public records requests. You can see my emails. Please find me a way to do this without spending general fund money. We don't have general fund money. We have so many needs in this city. So the fact that we have found, the fact that they know that we have ARPA funds that will be perfect for this situation relieves me as a council member, because I've got the funding. I'm not coming to you for more. And I know that we have District 2 is a hospital taxing district. At some point, I need you guys to pay your own rent, because this will be successful. And you have the ability, through the $1 million we give you a year, to fund this. And it doesn't end there. You guys have been talking to the fire department. We need, as a council, your support, because we have other things. We have an EMS utility. That is what helps pay for these ambulances and part of the personnel. We have gone backwards in the last couple of years, $400,000 in the EMS utility fund, because we as council members got so much pressure to not raise the monthly utility rate up to the appropriate level that the people that did the study told us to. You're at about $30 and change a month. For us to be where we need to be right now, we should be at 37 or so a month, and that's just being conservative. So what you can do for us is help us with the EMS utility rate that's going to come in front of us, and understand why we need to adjust that to a level that supports your EMS and fire departments. And I thank you so much for finding the ARPA fund avenue to actually accomplish this, because you know how scared I am of our general fund and all the money that we need to spend in different areas. So I can't thank you enough.
If I could.
We got, this will be our last question, Allison. We're at 7:30 here, so go ahead, Matt.
Got no pressure. I was just trying to Tetris things in my head a little bit, because you said it was going to be in the Beach Bum location. Is that going to be big enough? Just accounting for like 8 rooms and equipment and everything else.
Yes, it's big enough. We've had the hospital look at it. They drew out a drawing, and we'll have an architect sharpen that drawing up, but that's what we're starting out with. 6 rooms, and hopefully we gonna need 12 rooms in some time, down the road, but we can look at that at that time. We need to start somewhere, and so that's what we're doing. Yeah, go.
If we're using ARPA funds, why aren't we just purchasing the whole building and making that a hospital? Because it's big enough, it has a door on the other end that would make an excellent ambulance bay. I mean, if we're going to do this once and for all right at the beginning, what's the cost of that building, and what's the cost they're short on ARPA funds to do that?
Well, that's a great idea, and we've talked to the owner, and it's not for sale. So anyway, we're going to wrap this up. I want to thank everybody for coming tonight and great comments and questions. Can't thank you enough for that, because this really makes it special.